Criminal justice reform, breaking the cycle on drug use and crime. The United States criminal justice system faces significant challenges. Over the past 25 years, the U.S. prison and jail population reached an all-time high, and the number of people on probation and parole doubled. In 2009, nearly 7 million individuals were under supervision of the United States. Federal criminal justice system. Nearly 2 million of these individuals were incarcerated for their crimes, while the remaining 5 million were on probation or parole, being supervised in their community. While both the federal and state correctional system must address this issue, states generally bear the cost related to this population, and correctional spending has dramatically kept pace with the rising corrections population. Between 1988 and 2009, state corrections spending increased from $12 billion to $52 billion per year. Despite these significant expenditures, far too many offenders return to drug use and crime upon re-entry into society. In 2009, parole and other conditional release violators accounted for 33.1% of all prison admissions, 35.2% of state admissions, and 8.2% of federal admissions. 24% of parolees ending supervision in 2009. Among state prisoners who were dependent on or abusing drugs, 53% had at least 3 prior sentences to probation or incarceration, compared to 32% of other inmates. Drug-dependent or abusing state prisoners were also more likely than other inmates to 80% or more of male arrestees tested positive for the presence of at least one drug at the time of their arrest. Drugs and veteran courts. Drug courts. Drug courts have operated in the United States for more than 20 years, involving the collaborative effort of the judicial, prosecutors, community corrections agencies, drug treatment providers, and other community groups, support groups. Drug courts combine treatment with incentives and escalating sanctions, mandatory and random drug testing, and aftercare, and are a proven solution that reduces substance use, prevents crimes, and maximizes limited financial resources. With more than 2,500 drug courts in operation today, approximately 120,000 Americans annually receive the help they need to break the cycle of addiction and recidivism. Judicial drug courts. To prevent young people from cycling through the juvenile justice system or entering the adult criminal justice system, drug courts have been expanded to serve the unique needs of juvenile offenders. Veteran treatment courts. Based upon the success of drug courts and pronounced need to address challenges unique to our nation's veterans, veterans treatment courts are being established in jurisdictions across the country. VTC utilizes the same rigorous protocol of treatment and personal accountability to treat veterans suffering from a substance abuse and or health disorder, while helping ensure public safety. Justice reinvestment. Nearly every state is struggling with significant shortfalls in revenue and making significant cuts to spending in order to close budget gaps. In making these cuts, many states are focusing attention on correction spending, one of the fastest growing lines in a state budget over the past 2 decades. Drug market intervention, which is DMI. Overt drug markets are major threats to the health and safety of the community in which they exist. They are magnets for crime, drug use, and addiction, draw local youth into the drug trade, and dramatically reduce the quality of life for area residents. One innovative pre-arrest diversion strategy that shows promise in reducing the presence of drug markets in drug market intervention. DMI is a multi-step collaborative process that involves the combined efforts of law enforcement, prosecutors, influential community members, social services, reentry services, community corrections, faith-based organizations, and city management. Improving treatment for incarcerated offenders. Despite the high prevalence of substance use and abuse before prison, relatively few prisoners ever receive substance abuse treatment while incarcerated. In fact, roughly 4 in 10 prisoners reported participating in some treatment services. Just 1/4 of men and 14% of women reported participating in a formal drug or alcohol treatment program while incarcerated. Offender reentry. Each year, more than 700,000 people are released from state and federal prisons, while another 9 million cycle through local jails. When reentry fails, the costs both socially and economically are high. Statistics indicate that more than 40% of offenders return to state prisons within 3 years of their release. High rates of means more crime, more victims, and more pressure on an already overburdened criminal justice system. This is a law and order court. This is an officer making a drug arrest.